Beverly Hills, land of the rich, home of the famous. Sure, the stereotypes exist, but what most people don't know is the truth behind the plastic. If there is anything I have learned in all my years as a plastic surgeon, it's that appearances are not always as they seem. I get patients from all over the world, from celebrities to the average everyday housewife. But there is one thing they all have in common. Everyone needs a lift. Welcome to my world.
I'm Michael B., a jewelry designer, and this year has been a hard-working year for me. I've been working very hard to lose weight, and since I lost my 40 pounds, and I look in the mirror one morning and noticed that my neck is drooping and my eyes are a little droopy and I look a little tired. Since I work with a lot of celebrity clientele, I need to look good, and so I decided and see Dr. Kassabian, and Dr. Kassabian has done procedures on my wife and my dear friends, and I trust him. I feel very comfortable seeing him. Basically, I would not let anybody else touch my face. I spoke to him on the telephone, and he promised me that he would make me look very handsome, and I told him that I want to look like a movie star and young, and he promised me that he would do a great job, and I can't wait to see him and get this procedure going.
Michael is a well-known jeweler in Los Angeles and is a good friend of mine. He has some concerns about facial aging, so let's see what's bothering him. Nice to see you, Michael.
Nice to see you, Dr. Kassabian. How are you?
Welcome. What brings you in today?
What brings me here is that I lost almost 42 pounds.
Yeah, I see that.
So I noticed some sagging on my neck, and then I start seeing my eyelids are coming down, my face is, yes, it's shaping up very nicely, but not the way I like it. My wife suggested that I should come and see you. It's time for me to beautify myself a little bit. And I'm here because I trust you. Obviously, I trust you a lot to give you my face.
Thank you.
You know,
Thank you.
you have earned it. So, you know.
Michael, you've done a good job losing the weight. You're taking care of yourself. And now it's time for me to take care of you and the things that bother you.
Yeah.
So from top to bottom, I think you need some eyelid rejuvenation with the brow lift. So endoscopic brow lift to lift the tail of your eyebrows.
Okay.
Take care of the extra skin on your upper lid.
Okay.
The lower lid, get rid of some of the saggy skin and the fat that's bulging out. And then here a neck lift to tighten up the muscle and the loose skin in the neck, and some fat injection here around the cheek area, the under eye area, and in the nasolabial fold, these lines, the smile lines and the corner of the mouth.
Really?
Yeah, all in all, that would make you look fresh and would get rid of the extra skin. And
kind of the stress look kind of the thing on my face?
Yeah. And it would make you look as good as you feel.
Okay.
All right.
That
So this surgery
good.
takes about 4 hours to do.
Okay.
Recovery, you're looking at a week, 10 days. Okay. I expect you to be back to work like in 10 days to 2 weeks maximum.
So let me ask you something. When you work on my eyes,
Yes.
will I be able to see?
Yes, absolutely.
I'll be able to
Absolutely.
How
Yeah.
bad? How much do I have to suffer with the pain on my neck?
This is just, even though we're tightening up the muscles,
Yeah.
but it's not a uncomfortable procedure. You'll be
Okay.
very comfortable.
Okay.
All right.
Okay.
So, and most of the stitches will be out in 5 days,
Okay.
and most of the swelling, bruising gone in
Okay.
about 10 days. Michael, do you have any medical issues that I need to know about?
Any medical issues? No, but I take blood thinner, and I have AFib,
Okay.
and I checked with my cardiologist that I was going to do procedure before I came here actually, to discuss certain things because of my blood thinner, and he says there are ways that we shouldn't have any problem.
So that's a common thing, and I'll review your records and I'll work it out with your cardiologist, and we'll switch you from Coumadin to Lovenox,
Okay.
and get you ready for the surgery.
He had
and
told
then,
me about that.
And
yeah.
then around the time of the surgery, you'll be off the blood thinner
Okay.
for a short period of time, have the surgery, recover the first day. Once I see everything's going on well, within 48 hours you'll be back on your blood thinners.
Oh, okay.
So that will be very safe thing.
Wonderful.
But I'll work it out with your cardiologist so
Okay.
that everything's
Well, I'm
taken
happy
care of.
about that.
Yeah, this is a very common thing that I do. There's
Okay.
a lot of people on blood thinners and various other medications, so I work around and so that everything is done in a safe manner. So Michael, next I'm going to be taking your photos, so we'll have the before, so you'll see how big of a difference you're going to have in the before-after photos.
Okay.
And you're going to be impressed.
Okay. Okay.
Alright.
I'm looking forward to it.
Michael, any more questions for me?
Yeah, I just want to make sure that you promised me I'm going to look like a movie star. You know, that's on, right? I mean, just...
Well, you're acting like a movie star,
Yeah.
so I'll have you look the part, no problem.
That's cool.
Yes.
Okay.
So next, if you're comfortable with everything, we'll go ahead and I'll have one of my patient coordinators help you with the
Okay.
scheduling and also coordinate everything with your cardiologist and move on.
Okay, I think this is very exciting. This is something very important I'm doing in my life.
Yeah, well, you deserve it.
Yeah.
You've worked hard, and now that you've lost the weight, you have to look as good as you feel.
Thank you.
Okay.
I just had my consultation with Dr. Kassabian, and we discussed about things that I wanted to do on my face and my eyes, and he assured me that it was a perfect timing, and I'm very happy that I'm going to go forward with this procedure.
Michael has some concerns about facial aging. In addition to that, he has lost a lot of weight, and that only contributes to that. His concerns are the droopy eyelids and the brow that makes him look tired and sad. Also, the cheeks are droopy and he's got hollowness underneath the eyes. And he's got jowling, loose skin on the neck area. What I proposed for Michael was to do brow lift and do the eyelid rejuvenation. At the same time, I'm going to be performing a facelift and a neck lift. These procedures combined will give him the youthful look that he's looking for, and I know he's going to be happy about that.
Hi.
Good morning.
Good morning. How are you? Good to see you.
Nice to see you.
Everything good?
Yes.
I'm ready.
Good. I like to hear
I'm
that.
ready.
Let's go
So
inside
let's
and
do
hear
this. Well, this is a great day. I'm ready to go into a surgery, and I'm excited, and yet I'm a little scared because I never let anybody touch my face and my body before, so it's something new, but I'm looking forward to looking young and rejuvenated, and it's hard to put it in words how I feel about this. And most of all, I was very grateful for my wife giving me the best Father's Day present, and I think my children, my family will be surprised to see me afterwards. This is a lot of fun.
Good morning, Michael.
Good morning, how are you?
Good. How about you?
Good. I'm
Today's your
excited.
surgery day. You ready?
I'm excited.
Okay, this is your
Looking
Father's
forward.
Day gift.
Yes, it is.
Fantastic. So let's go over the plan.
Okay.
Top to bottom, gonna do a
Okay.
brow lift.
Okay.
Then the brow lift is gonna raise your brow like this.
Okay.
Upper eyelid incision.
Okay.
Incision in your crease to get rid of the extra skin. There's a lot of extra
Okay.
skin there.
Yes.
Fat.
Yes.
Here, the lower eyelid. This is gonna be tightened. Tiny incision underneath your lashes.
Okay.
This needs to be tightened. The excess skin removed.
Okay.
The neck lift, small incision here to tighten these muscles, and then here the excess skin comes off behind your ears.
Okay.
When you wake up, you're gonna have 2 drains here
Okay.
for the neck, okay? And then
What does the drain mean?
the drain means it's a small tube,
Yeah.
like a spaghetti, and
Okay.
it sucks out every drop of fluid and blood that's in there, so there's less bruising and swelling for
Okay,
you.
okay.
You'll heal much faster.
Okay.
And then here, there's gonna be temporary stitches, the corner of your eyes. You're gonna see, but you're gonna have limited peripheral vision. Those
Okay.
will come out in about 5 days or so after
Okay.
your surgery. All right?
Is it uncomfortable?
No, you won't even know it's there. It's just that your peripheral vision is less.
Okay.
All right?
Okay.
And then some fat injections in this area, your under eyes, your temples.
Okay.
That's very important.
Okay.
Okay?
It
And
seems like you putting a whole new face.
No.
On my old face.
No, I'm unveiling the beauty that's there. I'm just getting rid of all this extra stuff.
Extra. Okay,
Yeah,
I'm
yeah.
looking forward to it. Thank you.
Me too.
Okay.
You're ready.
About to start Michael's surgery. Michael has lost 40 pounds. This is his Father's Day gift. To complete this transformation, he's going to be getting a neck lift, also his eyelids done with a brow lift and fat injection to the face. This will make him look as good as he feels. Just got done with Michael's brow lift and eyelid rejuvenation. Everything's going very well. Next is on to the facelift and the fat injection. Just completed Michael's facial rejuvenation. What that consisted of was his brow lift, upper eyelid and lower eyelid blepharoplasty, neck lift, and fat injection because he had lost volume in his temples, in his under eye area, the hollowness, nasal labial folds, that's the smile lines, and the corner of the mouth. So this completes his transformation. Michael worked hard at this. He lost 40 pounds and he had all this loose skin that didn't look good. So this is gonna make him look as good as he feels. Michael, you're 10 days out. You're looking great. How are you feeling?
I feel wonderful. I'm doing great, and my compliments to you accomplished what I wanted from you. You did a great job.
Fantastic. Let me check your scars.
Okay.
Well, everything, you're healing right on schedule. Okay. Everything is good.
Well, I'm happy to hear
Yeah,
that.
all your stitches are out at this point. You have a little bit of swelling and some bruising, okay? So within the next week or another couple of weeks, most of it should be gone.
Wonderful.
Yeah.
Wonderful. So my question is, I haven't been working out last week to 10 days. So when do you think I can start working out?
Now you can do some walking.
Okay.
I would hold off on gym and strenuous exercise till your bruising is gone. Because if you raise your heart rate, raise your blood pressure, you might swell up more and bruise more. So I don't want that to happen.
So we take it easy a little bit.
So take it easy another week or two. In the meantime, you can start walking and
good job.
Do mild weight exercises. Those you can do. All right. So I'm very happy, very pleased with what I'm seeing, and I'll see you next week, and we'll check on your healing and your progress.
Wonderful. Thank you. It was a good visit.
All right. So nice to see you.
Okay. I feel great. Today is the 10th day. I feel very happy. I've been looking in the mirror and I'm very happy with the results. First time I visit my office and everybody looking at me, they were all flabbergasted and they were so happy the fact that I looked 10 to 15 years younger, and I'm very happy with the results. It came out just the way I expected it. I didn't want to have the surgery type of a look, and I want to have the natural, like never touch my face, and it really makes me feel great. I'm happy with the results, so now I can lose another 20 pounds and don't feel like I'm going to be needing a surgery, and it's going to look completely natural, and I'm looking forward to it. So my 20 pounds may take another 90 days to 6 months. So I think hopefully I stay healthy and everything will be wonderful. It's been 6 weeks. Everything looks perfect. I think it healed very nicely. I'm very happy with the results. It's exactly the way I wanted. I couldn't be happier. So I'm here to see Dr. Kassabian to get his approval of saying everything is up and is comfortable with the results. Hi, doctor.
Hi, Michael. Nice to see you.
Nice to see you. I'm here to give you my utmost compliments today. not only myself, but all my dear friends. They were very impressed with the work that you have done. And I think that the bottom of my heart, you've done a magnificent job, and I'm very, very pleased with the results.
Well, I'm glad you and your friends like it.
Yes.
For 6 weeks out, you're looking fantastic.
Yes.
So
And
I
you
see-
promised me that.
Well, I see everything's healing nicely. Like the scars. You check the scars. Yeah, they all look good. Good. So in the next upcoming months, I expect the swelling to go down further. Things are gonna tighten up more. You're gonna see more of a definition, more of your jawline, and
You do?
yeah. You're gonna
Really?
see more.
I mean, so far it looks great. So you think that it's gonna
Yeah,
shape up?
It's gonna look better. It's gonna look better.
Okay, that's
But I like
nice.
what I'm seeing so far.
Yeah.
And thank God everything went very, very well.
Yeah.
You know, despite you being on blood thinners and having the
Yeah.
smoking history, but
Yes.
everything you healed very well. So as it should be.
Okay.
So uneventful recovery. So
Thanks.
which is a good thing.
Thanks. I appreciate that.
Okay, so I'll see you like in another 6 weeks, and
You
we'll
got it.
go from there.
You got it.
Men have similar concerns to women when it comes to aging and looking more youthful. In Michael's case, there was the added factor of him losing a significant amount of weight. That contributed to him having more loose skin, especially in the neck area. As a successful jeweler, Michael is in the public's eye, and it is important for him to look his best in the day-to-day interactions with clients. And I'm just excited to see him so happy. We had some concerns about Michael's prior medical history. He was on blood thinners around the time of the surgery and also had a previous history of smoking. So despite these, he did have an uneventful recovery, and now he's healing very nicely. In the next upcoming months, I expect the results to get better as the swelling comes down and the collagen buildup tightens up the skin. Overall, I'm very happy with Michael's recovery, and I know he's happy about the results. Now that he does look his best, I expect him to continue in his successful ventures